one of the big things is, and this is like a psychological term, the doctor is supposed to know. There is a position supposed to know, supposed to enjoy, supposed to learn, but we are in a position of supposed to know. If a patient has back pain symptoms, those symptoms are justified by us existing, as we are supposed to know what those mean. We are supposed to know why this happened. I'm sure you've been asked that why is it like this, right? Why is it staying this way? And very slowly through a visit, you can kind of do tests and kind of discern what is going on, and tell them that you do know. I feel like a lot of doctors skip this I'm in this supposed to know position and go to, I know what you need to do to get out of this is. I know I need to manipulate your occiput on the left. I know you need this motorcycle looking handle to scrape through your quads. I know that is what you need, previous to the patient going, what the heck is going on with my shoulder? Why is my hand numb? Why does my elbow hurt? Because you exist, you are supposed to know. And so I think a lot of that value that you're talking about is explaining to them what is going on. That is a big set of a value, and you can't, yes, you should do a great history and listen to them and ask good follow-up questions. But sometimes even that won't peel away enough layers where they are going to be convinced that you do know what's going on. There's such a big part of it where palpating the area of pain. How many times does a patient go, oh, right there? And then you're like, okay, cool. That's the levator. It kind of goes through the upper trap, the big transition area. And they'll go, yeah, right there. And you're like, uh-huh. And it just gets tight when you shrug your shoulders up in bad posture. And they go, yeah, right there. And you're like, I'm explaining this to you clearly, but you continue to push on that area. And just so you know, the patient is asking you physically, but not verbally, that they want you to touch right there as well and validate what it is they're feeling. And you cannot do that via telehealth. So if you ever see a patient, and this is just good practice to know, I had to hit my face a couple of times treating patients, but if patients continue to push on something over and over and over, whether they know it or not, they are asking you, please palpate this area and give me some understanding about what's going on. You're like, yeah, that's a trigger point. Yeah, those muscles get tense and get knotted up, No, they're asking you to put your hand where they're putting their hand. But now you can't do that. So what is it that you are going to do to clear their mind, to give them some mental relief of their signs and their symptoms?